Go.
Okay. So you have your descending aorta, which is divided into the thoracic and the abdominal. Both of them are, the whole thing is the descending aorta. The border where it goes from one to the other is the diaphragm. In the abdominal aorta, it splits off into these major branches that come off before it goes into your common iliacs. The first is the celiac trunk, which is this group of 3 arteries here. The first one on the top is the gastric artery. This one on the right is going to be your common hepatic. There's 2 hepatic arteries. There's the hepatic proper and the common hepatic. This is the common hepatic. This one is going to be your splenic artery, and it just goes straight to your spleen and it's done. That's it. Now this guy's going to go to your duodenum and your stomach, and he's going to branch off from there. Well, the stomach. He goes to the stomach and he hits all of the arteries on your stomach, which you can't see on the model, so you don't have to worry about them for your lab. On the hepatic proper, he splits off, or on the common hepatic, he splits off into the hepatic proper and the gastroduodenal. When it hits the gastroduodenal, there's the left gastric, or the gastroepiploic, which goes up the stomach, and the one that goes down the duodenum between the duodenum and the pancreas is going to be your pancreatoduodenal artery. So the pancreatic duodenal artery is here, coming off of this guy. The other one that comes off this guy is going to be your hepatic artery proper, which goes directly into the liver. The blood vessels going into the liver. You have an arterial supply going in the liver through the hepatic proper. You have a venous supply going into the liver from the hepatic portal vein. And the only thing that comes out of the liver is going to be the common bile duct. So where does the blood from the liver drain into? It goes directly into the inferior vena cava. It doesn't have a venous supply coming off and then going in through the veins. It goes directly to the inferior vena cava. I believe it's the only organ that does that. And the inferior vena cava just is a straight run to the heart. So the vein the vein here at the liver is going into the liver. Know that. Know that it's not coming out. Alright, so the rest of this guy, after the celiac trunk, the next thing we're going to hit is the superior mesenteric. So we're going to talk about the superior mesenteric and the inferior mesenteric. The superior mesenteric is going to split off to give you your right colic artery, your middle colic artery, and your ileocolic arteries, which are going to come off of here, and they're going to hit pretty much all of the small intestines. Those are all branching off of the... Oh, I lost a kidney. Those are all branching off of the superior mesenteric. The inferior mesenteric is going to supply the left colic and the sigmoid arteries, but all you need to worry about is the left colic. So the inferior mesenteric is the left colic. The superior mesenteric is the right, middle, and ileocolics. The only thing that's really left is these 2 guys in the middle. These are your gonadal arteries, and they're going to drop straight down to your gonads, whether they be ovaries or testes, depending on gender. But they both come off of here. Other than that, you have your renal arteries, which come off and go directly into your kidneys. And,
What's right here? Where's the phrenic?
I think that is the phrenic.
That is the phrenic.
Yeah, that is the phrenic. It's supplying the blood vessels to the entire diaphragm.
That long way there?
Yes. You can see how it branches off into this muscle.
Are these all your intercostals then?
Yes. Yeah, those are going to be intercostals, as you can see them going in between the ribs.
That's like a generic name, I don't have any other name.
Right. And these guys are just your pulmonaries. So pulmonary veins and pulmonary arteries. Is there anything I didn't hit?
Carotids or something?
Common carotid.
Okay.
Common carotid. It's at the head that they separate into the internal and external carotid.
Okay.
And this is the internal jugular. You can't really see the external jugular on this side, but you can see the external jugular on this side.
Okay.
Yeah, the external jugular drops into the subclavian, whereas the internal jugular and the subclavian come together to form the brachiocephalic veins.
Cool. What about, are any of these we need to know?
No. Yeah, you don't need to know those. That's the femoral, but you won't be asked that.
So that's the external jugular vein, on the other side is the internal jugular vein?
Well, you can see the internal jugular here and at the base here. On this side, you can only see it at the base. The external jugular is only visible on this side. It's not even present on this side. It should be. It's just not present on the model.
And then the carotid artery.
Yeah, and then the common carotids. Not just carotids, but common carotids. Is there anything I missed?
I think that's good. And is there anything else they can ask, like lymph tissues or sexual organs? Well, those are going to be
On
easy.
the models, not really.
Yeah.
That's mostly
No.
going to be lecture questions.
Alright.
Know what a MALT is. Know that it's basically the same thing as a Peyer's patch. Know what MALT stands for, mucosal associated lymphoid tissue. Know what lymph vessels are draining the lymph in your body into the subclavians. So know that the cisterna chyli is draining through the thoracic duct, through the left thoracic duct, into the left subclavian, and that's 75% of the lymph in your body. Know that the, what is it on the right? It's not the thoracic duct, it's called something else. Know that it's draining only 25%, and that's from the right half of your head and your right arm, and that drops into the right subclavian. Difference between white and red pulp in lymph nodes and in the spleen, because the spleen's basically a giant lymph node. Know what your major lymph nodes are, such as your tonsils. So you have the pharyngeal tonsil, you have two palatine tonsils, and your lingual tonsils.
What about the these are the inguinal lymph nodes right there? Just that
Yeah, those are
area?
inguinal lymph nodes. It's the area.
Pelvis.
Yeah. Pelvic?
Pelvic?
Yes. Pelvic.
Yeah.
Actually, the purple's not lymph nodes. The purple is nerves.
Oh, okay.
Yeah, so it's just right here.
Because this right here on the right side of the model is part of your sympathetic chain ganglia wrapping around.
Alright, so I think
That's about it.
Is that the intercostal part?
Yeah.
Okay. Vein?
Purple, it's a nerve.
Nerve? Oh, never mind.